Hi, everybody. Welcome to the last lecture in chapter 20. So in this lecture, we're going to talk about fetal and newborn circulation. So there's a major difference in how blood flows and in how nutrients are delivered in the fetus and then in a newborn as well as in an adult. The fetus receives oxygen and nutrients from the placenta. So in a newborn, we get our oxygen from the lungs, and the nutrients come from the food that we eat. But in the fetus, all the nutrients come from mom, all the oxygen comes from mom. So everything is coming from mom, and it all comes from that placenta. And because of this, and because the lungs are non-functional, we have to have modifications of our blood vessels to get the nutrients to the proper areas. There we go. All right, so I found this picture and I thought it was a good one. So this is what I'm going to use to explain fetal circulation. And so here we have our lungs. We have a right and a left lung. We have our right side of the heart and our left side of the heart, right atrium, right ventricle, left ventricle. This is the superior and this is the inferior vena cava. This is the aorta, pulmonary trunks here, or pulmonary trunk is right here. These are not the pulmonary trunk. Pulmonary trunk leading to our lungs, and then these are the pulmonary veins leading to our atria, okay? So blood comes in from the placenta. We get oxygen and nutrients coming in from the umbilical vein. So you see the umbilical arteries are moving into the placenta, and then we have gas exchange and nutrient exchange, and we get this nice oxygen-rich, nutrient-rich blood moving through the umbilical vein. Normally, the umbilical vein would then move into the liver, but we have this spes ductus venosus that branches off and leads directly to the inferior vena cava. So the inferior vena cava is going to be oxygen poor because you just delivered all the nutrients to the different tissues. But now we have oxygen rich blood coming in. And so this is actually going to be oxygen mixed blood coming into the right atrium. And so again, we have oxygen poor blood coming in, oxygen rich blood, and so we have this oxygen mixed blood in the right atrium. Now, blood can go from the right atrium down to the right ventricle like normal, and then it moves out through the pulmonary semilunar valve into pulmonary circulation. But most of the blood, because the right side of the heart has a higher pressure than the left side of the heart at this point, most of the blood is going to move from the right atrium directly into the left atrium through this little tiny hole called the foramen-ovale. And so we have this oxygen mixed blood moving into the foramen-ovale through the foramen-ovale into the left atrium. It then moves down into the left ventricle and out through the systemic semilunar valve into the aorta. Any blood that does move into the right ventricle that moves out into the pulmonary trunk, some will go through the pulmonary arteries to the lungs, but the lungs are non-functional. The lungs are the last organ to really become functional, to maturate. And so nothing happens in the lungs. And so the majority of this blood that enters the pulmonary trunk is going to be shunted over to the aorta via the ductus arteriosus. And so now we have all this oxygen mixed blood that moves out into our system and delivers nutrients. And then oxygen poor blood starts moving back through the veins back to the heart, but then we have the oxygen mixed blood moving from the umbilical arteries to the placenta, And we have oxygen-rich blood coming from the placenta through the umbilical vein back to the inferior vena cava. So we have all these different structures in the fetal circulation. These structures are going to change as soon as the child is born. So as soon as the child is born and with that child's first breath, pulmonary arteries will dilate. They will open up. The lungs open up. And at that point, the right side of the heart, the pressure decreases and the left side has a higher pressure. So this is going to close that foraminal-velar. You no longer have the pressure on the between the atria that is forcing that ovale opened. So now you're going to have it closed and it's going to actually seal up. The umbilical veins and umbilical arteries become non-functional. The placenta is no longer feeding them. And so these become ligaments that are associated with our liver. The ductus venosus that was transporting blood directly from the umbilical vein to the inferior vena cava becomes the ligamentum venosum, which is also associated with the liver. So they all basically become ligaments. The foraminal-velar I mentioned is going to close up and it becomes a remnant called the fossa ovalis, which is a small depression in the interatrial septum. And then the ductus arteriosus becomes the ligamentum arteriosum. And this closes up just a few hours after birth. I always, if you remember from last semester, I asked a question in the very first exam about the heart and how individuals or babies are born with a hole in the heart. That's looking at that fossa ovalis, if that foraminal-velar is still opened. That's one of those holes that can be there in the heart that can lead to different problems. So I always like to point that out. Now we're actually talking about that. And some of the reasons for that, you know, could be because the blood pressure is not right in the child, or because of some genetic malformation of the heart. You know, there's all kinds of reasons. But back in chapter 1, when we talked, or back in exam 1, I was just looking at the structure and the function differ. And so if the structure's wrong, the function's off. So lastly, I'll mention that the circulatory system, the cardiovascular system, all of our organ systems work together. And here you can see how the cardiovascular system works in all of these different organ systems. You can read these, what they do, and how they work together. Okay, so at this point, we have finished chapter 20 and we are done with our second organ system. What we have not done in this lecture is looked at all the blood vessels, but that we'll be doing in our lab. So enjoy the rest of your day and I will see you in class. Bye.